damage from the Boston bombings isn't just physical. The emotional toll also devastating. So, as victims and families begin to recover, are they really at risk for PTSD, just one incident? And if so, how do they cope? Let's ask Dr. David Samadi of the Fox Medical Aid team. Doctor, is it right to say PTSD after one incident, as traumatic as it is?
Yes, absolutely, Brian. And we have to be very careful because as we come out of this and the recovery starts, that's when you're going to see a lot of people being affected by this. And the key word was emotional, psychological, and there are a lot of behavioral symptoms that will come. PTSD is actually a normal reaction to an abnormal event, such as this. A lot of times people, equate PTSD to the Iraqi war or to Vietnam, but you may have Sandy storm, you may have a hurricane, you may have a natural bombing like this. So you got to be very careful about some of the symptoms on the way.
And you also talk about the phases, real quick. The phases that we should look for.
Some of it, the first phase, Brian, is that they remember, they recall, there are flashbacks, the sight of the blood, the kids are running, bleeding, etc. The second one is really making sure that they become isolated. They don't want to deal with anybody, flat affect, they don't want to interact with anybody. And the last phase of this is really the arousal, which is the anger, frustrations. All of a sudden they burst into anger, they can't interact with anybody. And the sooner you interfere with this, the sooner you get help and interact with the other families and recognize that you have a problem, the better we can take care of this.
Tell me if this is splitting hairs, but if I'm trained to be an Army infantryman, I'm wearing the camouflage, wearing the helmet, I'm fighting a war, I still might suffer PTSD. But if I go to watch a marathon and that traumatic event, same happens, with the same type bomb happens to me, is it harder to overcome that as opposed to somebody who was trained to deal with this?
Absolutely. And I think any kind of exposure to this kind of tragic, traumatic event is going to trigger that kind of behavior. Now, some people recover from this, and within the first 30 days, that's called acute stress disorder. Once it goes on over 30 days, you're going to get into the PTSD zone, and you've got to be very careful. The key to a lot of people is that if you're suffering from these symptoms, there are a lot of hotlines, there are a lot of people out there to help you, and you just have to ask for it, and that's important.
Now, I want to bring you to one specific incident, very specifically tragic.
Yeah.
You had these Norton brothers watching this event, watching a friend finish, and they were blown up. Both of them lost one leg.
It's just unbelievable what is going on, and my heart goes to them, and I hope they have recovered from this. But look, they're going to be affected by this. Their families are going to be affected by this, and we need to keep an eye on a lot of people that have been there. Sometimes part of the therapy, unfortunately, is to go back to the scene. It's almost somebody who is afraid of the height. You bring them back to the scene, and kind of over time they can recover. There's psychotherapy. Sometimes the symptoms are so bad, Brian, that they have to go on some of this antidepressant medication, anti-anxiety. But the biggest part of this segment is that, don't be afraid to ask for help. There are a lot of psychologists and psychiatrists out there who can listen to you and help you and engage the entire family. The end point of this, if it's not taken care of, it's a lot of drug abuse and alcoholism and break up the family. And that's the part of fear of this whole PTSD.
I don't have a much bigger, much grander in scope, and it was from another country. I don't know who did this. But don't you get the sense that America has learned over the last 10 years and doesn't react the way we used to, maybe react a little bit better, a little bit more street smart about this?
America is a beautiful country, and, it's open, and of course, we have the sense of forgetting over time. After 10 years of 9/11, we let our guards down. This is a very unfortunate event, but we have to stick together and get through this and always be aware of some of the stuff that's going on in our world.
And it's just amazing how great the medical community reacted in Massachusetts. It's going to go down in history. It's just
They've done an amazing job, and we're all available to them.
Dr. Samadi, thanks so much.
Good to see you, Brian.
All right, 13 minutes before the top of the hour. You see the commercials all the time.